goes down your leg. This test is going to assess to see if you have a movement that's going to make that pain better. So for the sake of this test, we're going to assume I have pain into my left leg and it's all the way down to my foot. So the full length of the nerve is irritated. I'm having numbness, pins and needles, all the way down to my foot. So there's 3 different movements we're going to do. We're going to do forward bending, backwards bending, and side gliding to left and right. And you're going to assess after those movements if the pain is coming up the leg and closer to the back. So remember, I have pain all the way into my leg. If that pain, after I do some of these movements, is to my knee and no longer in my foot, that's good, you're going to keep going. If it comes all the way up to my back, great. You're trying to get the pain out of the leg and into the back. So your back pain might increase, but if it's out of the leg, it's good. So the movement you're going to start with is bending forward. You're going to bend forward 10 to 12 times, as comfortably as you can. So bending forward. After your 10 to 12 reps, assess where the pain is in your leg. If the pain's coming up out of the leg, then you're good with forward flexion, and that's going to be your movement preference. If it's worse, you're going to try these other movements. So the next movement is going to be backwards, hands on your hips, bending backwards as far as you can. Again, the first couple of reps might be uncomfortable, but I want you to do 10 or 12 and then reassess. If it's worse, stop. If it's no better or no worse, do another set, keep going. If it's better, then definitely keep going. So again, 10 to 12 back bends, reassess where that pain is in your leg. If it's better, backwards is going to be your directional preference, and you're going to stick with that through the ebook. So the last one we're going to do, if I have pain into my left side, I'm going to turn and put my right side towards the wall. And you're going to stand either forearm on the wall or forearm against your ribs and shoulders on the wall. Your feet are going to be away from the wall, and you're going to push your hips towards the wall. So I'm leaning against the wall. My feet are about 2 feet away from the wall, keeping my shoulders level, and I'm going to push my hips towards the wall. Again, 10 to 12 reps. Assessing if that pain is coming up out of the leg. If it gets better, keep doing it. If there's no change, keep doing it until you can maybe elicit a change. If it gets worse, stop. You're going to go through all 3 movements, find a direction that hopefully works for you, and you're going to stick with that movement throughout the ebook.